Hi, it's Dr. Elisha Van Dusen, New Hope Chiropractic again. Today's 3-minute health talk is going to be about intermittent fasting. So this is intermittent fasting part 2, and I'm going to talk about some of the physiological effects of it and also some of the benefits. So physiologically, it releases human growth hormone, and the levels of growth hormone actually skyrocket and increase as much as 5-fold. And this has benefits for fat loss and muscle gain, just to name a few. Insulin sensitivity also improves, and the levels of insulin drop dramatically. And these lower levels of insulin actually make stored body fat much more accessible, and it gets burned faster. Your cells with intermittent fasting also repair. So your cells initiate cellular repair processes, and cells actually digest and remove old and dysfunctional proteins that build up inside the cells. So your body cleans itself up. Gene expression, there are also changes in the function of genes related to longevity and protection against disease, so it increases your body's ability to stay healthy. So these changes in hormone levels, cell function, gene expression, etc., are responsible for the health benefits of intermittent fasting. So your growth hormone levels go up and your insulin levels go down, and your body's able to self-repair. Also, intermittent fasting is a very powerful weight loss tool, and that's actually the most common reason that people do intermittent fasting. You eat fewer meals, and that leads to an automatic reduction in calorie intake. Also, it changes hormone levels to facilitate weight loss, and it also increases the release of fat-burning hormones like norepinephrine or noradrenaline. So this increases your metabolic rate. So as a result of an increased metabolic rate and a decreased caloric intake, you're burning more calories, you're taking fewer calories in. As a result, you lose weight. And in a study in 2014, it was actually shown to cause a weight loss of 3 to 8% over periods of 3 to 24 weeks. And it's actually a very large amount compared to most other weight loss studies. Also, people lost 4 to 7% of their waist circumference too. So they lost large amounts of harmful belly fat. And also this fat builds up around the organs and causes disease. The heart, for example, that can cause heart disease later on, coronary artery disease. And it also causes less muscle loss than more standard methods of continuous calorie restriction. And so the main reason this works is obviously that it helps you eat fewer calories overall. But if you binge and eat massive amounts during the eating periods, then you may not lose any weight. So it's important to keep an eye on what types of calories and how many calories you're actually eating during your eating periods on this intermittent fasting method of eating. So that's it for today, and we'll see you next time.